Good evening all of you and welcome back to the clinical discussion. You all know that we are discussing GIT and liver clinical discussion, that is clinical questions which is relevant for NEET and ini-CET MDS entrance examination. Okay, we've already done our part 1, we are going to start with our part 2. Now here what we are going to discuss is majorly again diseases related to GIT and liver, and it will contain questions. Okay, we'll start with the questions there. Then we will understand certain liver enzymes and liver proteins. Okay, this is where the questions, the key points are relevant. Okay, this is where you have to understand the key points and rule out the options or find out the correct answer. Now, one more thing, just to give you a little bit more idea, we'll connect the liver enzymes or the diseases which is relevant in liver or the enzymes which is relevant in liver diseases is also connected to some other disease, especially heart diseases, and one more which is going to be a surprise. Okay, you might have seen the questions, but you will just connect it today. Now, if you just see, if you start, we have the questions to be discussed first as usual. So we're going to again look into 3 questions here. Okay, now yes, this is the first question. A patient is having cholangiocarcinoma. Now here, this cholangiocarcinoma is irrelevant if you know the key point or if you can rule out the key point here. With hyperbilirubinemia, again this is not the key point here. Blood, yes, that's the key here. Blood examination shows raised alkaline phosphatase. The most probable diagnosis is. So if you can answer now, you can answer it. Okay. Is it hemolysis, or they can call it as hemolytic anemia? Is it cirrhosis? Is it obstruction of bile duct? Is it congenital syndrome associated with liver disease? Okay, that is what you have to come to. Now, yes, we'll come to the second question and then we will discuss the key points of each and then finally arrive at an answer. Now here, the patient is known or patient is having a known history of being an alcoholic and has cirrhosis of liver. Understandable. If he's alcoholic, there will be a possibility of cirrhosis of liver. The enzyme raised in, it is like asking you directly, which of the following enzyme is raised in cirrhosis of liver. Okay. Now finally, the third question, final question, a 45-year-old male has history of being chronic alcoholic again and has reduced albumin levels. Okay. On blood examination, he's suffering from. So yeah, this one option we didn't discuss, isn't it? So that is here it is, which is the enzyme being raised. Again, alkaline phosphatase, is it? Is the both questions same? Alkaline phosphatase here, and is it alkaline phosphatase itself, or is it AST, or is it ALT, okay, or is it gamma glutamyl transferase? We'll come to that. Now here again, they're asking the patient suffering from, again here they have said a protein, not enzyme. Here they have asked in cirrhosis of liver, alcoholic cirrhosis of liver, which is enzyme raised. Here they have given a protein which is raised in an alcoholic rather than enzyme. And yeah, on blood examination, not OB. He's suffering from what? So that's here the protein. So we have to know the proteins, we have to know the enzymes. That's what I was saying in various liver diseases. Again, if you come to the answer of the options here, multiple myeloma, cirrhosis of liver, is it obstructive jaundice or liver abscess? Means to say what type of liver disease. Multiple myeloma is, you can just easily exclude it right away here. Okay. So yes, if you come to the key points here in the first question, you'll just zoom in it and we'll see the key points here. The key points here is the raised ALP. They're asking the diagnosis. The key point 1 is it's the raised ALP here. Then that's the most important. I told you this is raised ALP is the key most important point you should be knowing. Cholangiocarcinoma and hyperbilirubinemia is not very significant. Hyperbilirubinemia, understandable, it is basically some kind of resulting in some kind of a jaundice here. Okay. So what is the question you have to ask if you don't find an answer right now? What is the question you have to ask yourself? ALP is raised in which liver disease? That's the simplest of question here. Okay, directly if they ask you. Okay, so it is increased. So I'll come to the details of everything, but here the answer is ALP is raised majorly. Okay, ALP can be raised in many liver diseases, but the major disease is cholestatic liver disease. Now, what is cholestatic liver disease? I'll come to that. Okay. Now, here the question is, what is the enzyme raised? Okay, history of alcoholic, what is the enzyme raised? Now, the key point here is going to be? So, okay, we know answer is going to be obstruction of bile duct. Okay, cholestatic liver disease. One of the cholestatic liver diseases, obstruction of bile duct. Don't worry if you have not understand yet. But the key is ALP is raised in cholestatic liver disease. An example of cholestatic liver disease, obstruction of bile duct. Okay, we'll come to more details. So here, the key point is alcoholic with a cirrhosis of liver. They're asking what is the enzyme raised. Now, simple question, liver enzyme raised in alcoholic cirrhosis. Very, very simple. It is AST. Okay, aspartate transaminase more than ALT. Please note here. Both AST and ALT are raised, but AST is raised more than ALT. Understand? Now here, okay, we're going to come to details. Okay, don't worry. Don't think that now I have just getting some basic idea. Still I have confused. Don't worry. Okay, it is going to become more and more clear. But this outline, if you have, it becomes much better. Now here the key point is going to be, the patient is again alcoholic. There is reduced albumin. Okay, with alcoholic. So what is the question you have to ask? Albumin, I told you it's a protein. In which liver disease albumin is reduced? Okay, answer is not in all liver disease you have albumin reduced. Only in chronic liver disease, not in acute. Okay, only in very long-term disease, like example is cirrhosis. Okay, so yes, cirrhosis of liver, simple terms, in cirrhosis of liver, you have got your albumin raised. In chronic diseases, in cirrhosis of liver, you have got AST raised more than ALT. Okay, another point here is, it is not AST or ALT which is raised in cholestatic liver disease. In cholestatic, you have got ALP. In cirrhosis, you have got AST more than ALT. In cirrhosis, you also got reduced albumin. You understood all the questions. Okay, so these are recent questions, last 5-year questions based on that. Okay, so now let's come to the enzymes. Okay, we studied AST, ALT, we studied ALP. So there's the enzymes. Majorly you studied so far, but there are more than that. The enzymes, one is ALP, definitely, alkaline phosphatase. Okay, now something is clicking in your mind, isn't it? Bone disease, ALP, alkaline phosphatase, yes, that's what I told you, interrelationships. Okay, 5-nucleotidase, another enzyme which is related to liver. Okay, gamma glutamyl transpeptidase, another enzyme. Transaminases, AST, ALT, very simple. Okay, there are two transaminases, AST and ALT. Okay, then lactate dehydrogenase, one enzyme which you are familiar with. Okay, now yes, we're going to start with ALP, the first enzyme. Please note, ALP, alkaline phosphatase, though increase. Now I can go give a lecture where I can add these enzymes to any liver disease. Okay, ALP is raised in this list of liver disease I can give you, but this will not help you to crack NEET. This is what people with in third year, final year, second year, first year have to understand. You can write an essay on ALP. Okay, listing all the enzymes, all the liver disease. Now, when it comes to your NEET MDS preparation, you have to be very specific. That is, which liver disease very specifically has got ALP raised. Okay, which liver disease has very specifically ALP being raised. So, one disease is cholestatic liver disease. Okay, cholestatic liver disease. One typical example I told you, obstructive jaundice. Now, we have to understand what is cholestatic liver disease. Okay, cholestatic liver disease. Now here you have to understand, for understanding this cholestatic liver disease, you have to understand what is known as bile duct. Okay, so if you can see my mouse cursor here, this one, okay, you can see the liver there. Okay, so you know that the bile acids, bile salts is produced by the liver and stored in the gallbladder. Okay, so then it has to be released into the intestine. We studied the bile helps in the digestion of fat. Okay, so now this green, okay, this green you have to focus on. So the bile from the liver, the bile from the gallbladder, okay, bile from the liver is coming because it is synthesized in the liver. Now it goes to the gallbladder, it is stored in the gallbladder. So from gallbladder, the stored bile and new bile, if needed, can go to the intestine. This is the intestine there, okay, the pink one, through common bile duct. So this is basically, sorry, this is the green one, sorry. This is the common bile duct. Okay, this pink one is basically stomach. Okay, this green one, this one is the common bile duct. Now, obstruction, you can call it as bile duct or common bile duct. Any obstruction to the flow of bile is called cholestatic or cholestasis or cholestatic liver disease. Okay, any obstruction this. So that what happens? What is the outcome? The flow of bile is stopped, which can cause obstructive, yes, liver diseases. Okay, so yeah, obstructive jaundice is typically, and more other also. Okay, obstructive jaundice is one of the cholestatic liver disease. So here we are going to understand what is cholestatic liver disease. I just told you, affects the normal flow of bile from the liver to the small intestine, finally ending up in jaundice, because bile contains what? Bile acids, bile salts, plus bilirubin. So bilirubin is blocked to go into the intestine and finally excreted. So what happens? The bilirubin will go back, get into the blood, jaundice. So one reason, jaundice. Okay. Now examples. Now this is where you have to understand. Obstructive jaundice is one type of cholestatic liver disease. Okay. So any cholestatic liver disease, we have got ALP being raised. That's what we are discussing here. Okay. ALP being raised. Now obstructive jaundice is one type. Okay. Other is cholangitis, other is biliary atresia. You'll ask me, what is cholangitis? This is basically inflammation of bile duct. Okay. Now obstructive jaundice, it's not due to inflammation. Obstruction of bile duct is not due to inflammation. It can be due to gallstones. There is gallbladder stones or tumor in itself blocking this. Okay. This picture, if there is a tumor somewhere here, okay, or from the gallbladder, it can block it, causing obstructive jaundice. Okay. Whereas if there is bile duct being inflamed, it's called the cholangitis. If bile duct is absent, you call it as atresia. So basically, instead of here, what I mean to say here is they can change the option. Okay. Raised ALP, which of the following? The answer is obstruction of bile duct. Here they can put any other cholestatic liver disease. Okay, cholangitis or biliary atresia. Okay, and it is not seen in cirrhosis. It is seen in cholestatic liver disease. So that's basically the examples. Now we studied examples. Now we said what are the enzymes raised? Now you know ALP is raised. Not ALP alone. We have got 5 nucleotidases. We are going to come to that. Is raised. Gamma glutamyl transpeptidase is also raised. So that's another question in itself. Which of the following, or I would say in cholestatic liver disease, which of the following enzymes are raised? ALP, 5 nucleotidases, gamma glutamyl transferase. Okay. So now the question, I'll just come back quickly so that you have no confusion. A patient is having cholangiosarcoma. I told you, a tumor of bile or bile duct can obstruct. Okay. So yes, cholangiosarcoma, there is a significance of cholangiosarcoma here. With hyperbilirubinemia, because there is jaundice, obstructive jaundice. With ALP raised, it's not cirrhosis, definitely, it's obstruction of bile duct. Okay, the cholestatic liver disease. Okay, the cholestatic liver disease. Now, okay, we're continuing with ALP. So we said ALP is raised in cholestatic liver disease. Do you know now what is cholestatic liver disease? Now the same concept, I'm just repeating. Bile duct obstruction can cause increase synthesis of ALP. Okay, and this increase in synthesis of ALP by the epithelial, bile duct epithelial cells, and the bile builds up in the liver. Same thing, obstruction, thereby increasing the level of bilirubin. I told you the backflow, and finally causing jaundice. So this is why jaundice is there in cholestatic liver disease or obstructive. What is basically I'm talking is obstructive jaundice. Okay. Now another enzyme is 5 nucleotidase. Okay. Now again, it's increased in cholestatic liver diseases, like we told. It's also seen in liver injuries. Basically what it says, or it is saying here, is if there is obstruction or if there is cholestatic liver disease, the hepatocytes will get damaged, and the hepatocytes start synthesizing 5 nucleotidases. Okay, any damaged liver cells are synthesize 5 nucleotidases. Okay, so and it is majorly seen in cholestatic liver disease. Okay, now gamma glutamyl transferase, I told you, transpeptidase is another enzyme which is involved in the cholestatic. So 3 enzymes we studied, okay, in cholestatic liver disease. Now, does it mean that it is only seen in cholestatic liver disease? No, it can be seen in any, but majorly in cholestatic. That's the key. Another, I told you, the enzymes which you have to notice: transaminases, which is aspartate transaminases, and alanine transaminase. So aspartate and alanine is amino acids, biochemistry. Now, this is predominantly AST is increased. So AST and ALT basically is increased in liver cirrhosis. Okay, AST, ALT is increased in liver cirrhosis, but AST is increased more than ALT. Okay, so additional point to note here. Okay, just one point, that is, if you do, okay, before that, I just want to add one other point. That is, AST is increased 10 times than ALT. Okay, AST here in cirrhosis, I told you, AST and ALT increases, but AST is increased 10 times. So in the options, if you have AST and ALT and they're talking about cirrhosis of liver, which one should you select? 45-year-old alcoholic, reduce the albumin levels. So basically, no, they're talking about, cirrhosis of liver, which enzyme is raised. So you can see AST and ALT, which one should you select? The answer is AST, because AST is increased 10 times. Okay, so that is the best answer is going to be AST. Okay, if you have to select between two. Now, as I've told you, a point to note here, additional point. Okay, that is, if you do in alcoholic cirrhosis, an extra point, in alcoholic cirrhosis patient, if you do a liver biopsy, okay, you can see that something known as Mallory bodies. Okay, in cirrhosis you see Mallory bodies, which is nothing but alcoholic hyaline bodies. Okay, that is fibrosis of liver happens. In cirrhosis, basically what happens is fibrosis of liver. Okay, and this particular fibrosis with hyaline bodies, this is what gives rise to the Mallory bodies. Okay, so simple thing, question which can be asked: Mallory bodies are seen in alcoholic cirrhosis. Okay, alcoholic cirrhosis, liver cirrhosis. Now that was about transaminases, 2 transaminases we studied. Finally, lactate dehydrogenase, not very specific to liver. We'll come to that, which other disease has got LDH. Now we studied alkaline phosphatase enzyme. We studied the another enzyme which is AST/ALT. Now, and proteins also. Sorry, and 5-nucleotidase and all those. Now we have to understand the plasma protein. So what are the plasma proteins synthesized? What is albumin? Okay, albumin, globulin, all those are there. But 2 very important plasma proteins where you get questions on is, one is albumin and another is coagulation factors. There are much more, but clinical discussion, you have to understand 2 proteins. Okay, albumin, please note, it is decreased in, okay, in chronic liver disease. Okay, in chronic liver disease and not in acute. Okay, so example of chronic liver disease is cirrhosis. Okay, and please note, it's not decreased in acute liver disease like acute viral disease, acute abscess or liver abscess, obstructive jaundice. Obstructive jaundice is a cholestatic liver disease where you have got ALP is raised, not the decreased albumin. Okay, obstructive jaundice and drug-related hepatotoxicity. Now, drug-related hepatotoxicity is another example for acute liver disease. So basically, what it says here is, to decrease or for albumin synthesis to be decreased or for protein synthesis in the liver to decrease, it takes time. Okay, so it happens only in chronic liver diseases. Simple. Okay, not in acute. Okay, now let's go to the question which we saw previously. A 45-year-old male has a history of being a chronic alcoholic, has reduced albumin levels on blood examination, suffering from. Okay, so not multiple myeloma, definitely liver disease. Okay, because it's alcoholic. Okay, and so cirrhosis of liver, not cirrhosis. Okay, cirrhosis of liver, yes, that's the answer. And obstructive jaundice, we said no, not an obstructive. Liver abscess, again in a kind of an acute situation. So it's cirrhosis of liver, which is the answer. Okay, so we studied the first protein, which is albumin. Now coagulation factors. Now I have not put any details here. Basically, please understand, in liver disease, so again more in chronic liver diseases, you have got coagulation factors being affected. So again, coagulation factors are proteins only. So whenever there is this coagulation factor deficiency, there is going to be bleeding. So if you see a patient is having liver disease, he can have bleeding. Okay, so they can simple way ask you, a patient is having alcoholic patient, that this what having showing bleeding, what is the disease is suffering from? Liver disease. In simple way they can ask you. Okay, they can twist and turn. So please connect the liver disease with coagulation disorders, or please connect liver disease with bleeding. Okay, don't forget that. Many practicing dentists also don't do this. Yes, now what are the interrelationships? What enzymes has got the interrelationship? Okay, alkaline phosphatase. Another enzyme is AST. We studied AST is raised more in cirrhosis of liver, but it is connected. So means to say that ALT is more specific to liver than AST. Okay, AST or ALT is more specific to liver. AST is produced by other organs also, but in cirrhosis of liver, AST is raised 10 times more. That's the importance of it. Okay. Now, alkaline phosphatase. Now, where all do you see it? One is bone disorder. Other is WBC disorder. Bone disorder, you know, alkaline phosphatase, Paget's disease. But WBC disorder, there has been a question. I'll come to that. Okay. Now, in which bone disorder it is increased? In which bone disorder it is decreased? Okay. And one more point to note there. So, increase in, you know, very familiar Paget's disease, the most common disease with increased ALP. Okay. Among all these, the first you have to know it, Paget's. Osteogenesis imperfecta, you know, fibrous dysplasias, all these three you have the ALP raised majorly in Paget's. So this is oral pathology. Okay. Now, yes, increased ALP indicates increased bone turnover. You know this again in Paget's disease and all these diseases you have got increased bone turnover. That is more alkaline phosphatase. Means you have to take the phosphate from the bone, put it into the area, and yes, and the diseased area, basically that is what is happening here, isn't it? So it's alkaline phosphatase. Now please note, there is a disease where alkaline phosphatase is decreased. You might have come across this. It's called hypophosphatasia. It's one disease, you have to just note. So bone disorder, increased ALP, decreased ALP. Also note, I just want to add here something known as acid phosphatase. You know, the enzyme which is acid phosphatase, so this is alkaline phosphatase, acid phosphatase is increased in, just an additional point, okay, just to connect, osteopetrosis. And please note, this acid phosphatase increased indicate decreased bone resorption, and that is what is happening in osteopetrosis. Those who have studied oral pathology, what is happening in osteopetrosis? Okay, there is osteoclast defect, so there is no bone resorption. So basically, acid phosphatase indicates decreased bone resorption. Alkaline phosphatase indicates increased bone resorption, or of course I would say increased bone turnover. Okay, that's a better term to be used there. Okay, so increased, you know, this is just to connect. I'm not teaching you here. I just want those who have studied oral pathology can connect it better. Okay, that's why I've put it here. Now, yes, another disorder which is causing abnormality of alkaline phosphatase is WBC disorder. Now, there is something known as LAP, leukocyte. You might have seen this question somewhere. Leukocyte alkaline phosphatase. This is alkaline phosphatase in leukocytes. Okay. Now, here it helps to differentiate chronic myeloid leukemia from other myeloproliferative. Again, a question. Which of the following enzyme deficiency indicates or helps to differentiate CML from myeloproliferative disorder? It is LAP. Okay, that is LAP activity is low in CML. So means to say in other myeloproliferative disorder, LAP activity is normal. In CML, LAP activity is low. That's how you can differentiate CML from other myeloproliferative. Now, what is myeloproliferative? Myelo means what? Bone marrow. So, proliferative or proliferative activity happening in bone marrow. Any disease where you have proliferative activity happening in bone marrow is called myeloproliferative disorder. Okay? CML is one example. AML, any leukemia is one example. Even the polycythemias, because there also RBC proliferation happens. So any disorder where there is proliferation of cells inside the bone marrow. Basically, bone marrow is where you have blood cells in the cells, isn't it? So yes, that is two diseases, LAP and bone alkaline phosphatase. Finally, okay, these are some additional points. AST. Okay, now see, this is where you people have confused. Another name of AST is SGOT. Okay, little long name, serum glutamate oxaloacetate transaminase. Okay, fine. You can call it in either way, serum glutamic oxaloacetic transaminase or serum glutamate oxaloacetate transaminase, SGOT, which is same as AST, which is also seen in MI, myocardial infarction. So AST is raised in liver disease, AST is raised in MI. Okay, one. So AST is not specific for liver. ALT is more specific for liver. But now, in liver disease, AST is raised 10 times. That's why if you have a patient who don't have MI or you don't have symptoms of MI, okay, then you have to definitely consider AST to diagnose the liver disease. Okay. Now, yes, LDH is also raised, and so another liver enzyme raised in MI is LDH. Okay. So by that, I think we'll just conclude this particular discussion here. Basically, my purpose of discussion today was to give you some understanding. Okay, I'll just quickly go through it. Basically, to give you an understanding, ALP is raised on cholestatic liver disease. Another enzyme raised in cholestatic liver disease, 5-nucleotidase, which was in itself a question. Okay, so what is cholestatic liver disease was what we discussed. Okay, then we understood the enzymes raised in cirrhosis. Majorly it is AST, ALT is also raised. Okay, then we studied the proteins which is decreased in liver disease, especially cirrhosis, which is albumin. Okay, so that will give you a clear understanding of to solve these questions, because many students have this problem of, though it is very simple area, this confusion is there, especially when it comes to cholestatic liver disease, or I would say obstructive jaundice is an example of cholestatic liver disease. You know everything about jaundice, you know 3 types of jaundice, you know whatever is happening in it, but you don't know basically obstructive jaundice is cholestatic liver disease itself. Then you see cholestatic is something related to bile. So how this obstructive jaundice comes there? So what is the role of ALP there? So all these are simple things which if you connect, it becomes super easy. So thank you so much. We'll have some other questions being discussed in the next class. Okay. So see you. Take care.